Professor Taole Mokoena has been the country's new Health Ombud for almost a month now, but with strong links to the ANC, many have questioned just how fair and impartial Mokeona will be. And with the NHI around the corner, what challenges does the new Ombud foresee arising in our very fragile health sector? Newzroom Afrika's Andersen filed this report.
While the public health sector struggles and the national health insurance moves forward, it seems newly appointed Health Ombudsman Taole Mokoena has quite the task on his hands. Mokeona has been in the job since the 1st of June and has a big history in surgery. He spent time studying at Oxford University as well as the University of Natal. Staying with his medical history, Professor Mokeena recently retired as the academic head of the Department of General Surgery at the University of Pretoria. But medicine isn't where Mokwena's history stops. The now Health Ombud previously served as the chairman of Chancellor House, the ANC's main funding vehicle. When asked this week whether his ANC links would impede his new job, Mokeena came out in defense of the governing party.
I make no apology about that, First of all, the ANC delivered. The fact that you and I are sitting in this office together having this conversation at the good work of the ANC.
Praise for the ANC aside, the new Health Ombud insisted that his party links will not interfere and that all his work is always above board.
You ask about my role, the fact that I was chairman of Chancellor House, whether that will sully my objectivity. I've just said to you, those that know that know me and my track record, they wouldn't doubt. Although we're not here to speak about Chancellor House, but whatever I did on Chancellor House, it was clear, overboard.
This month, the National Assembly approved the much-talked-about National Health Insurance Bill, pushing it a step closer to being signed into law. The bill seeks to realize universal health coverage for all, which means that every South African will have a right to access comprehensive healthcare services at wherever facility is closest to them, regardless of whether that hospital is private or not. With the NHI having now taken a big step closer and still receiving plenty of backlash and fear over government implementation, Mokeena is optimistic about the NHI's potential. He even goes as far as describing it as probably the best thing anyone could give the country.
The fact that some of our infrastructure is crumbling is a concern. However, Rome was never built in one day, and no one eats an elephant in one morsel. You bite it one piece at a time. And no doubt, the people that are going to implement the NHI, they are going to implement it in stages that they can be able to monitor.
With the NHI progression likely to bring more questions around public health, Mokeena is likely to have his hands full throughout his term. For Newzroom Afrika on Channel 405, I'm Andersen in Johannesburg.